All right, earlier today, we learned about a measles exposure in Collin County. That individual was reported to have visited 3 retail stores in Plano, including a Ross, a Dollar Tree, and a Walmart. And as the measles outbreak continues to spread across Texas, concerns are rising among public health officials, parents, and communities. Today, we're joined by Mary Whitworth, an infectious disease specialist at Cook Children's, to help us better understand what's driving this outbreak and what we can all do to stay protected. Thank you so much for being here with us today. All right, well, first, let's talk about what factors are contributing to this specific surge in cases.
Probably it is a lack of vaccination, most likely. In West Texas, we know that the outbreak is spreading there amongst those who are susceptible, and that's the leading reason.
Well, what are some of the typical symptoms of measles, and when should someone seek medical attention?
Measles typically presents as a really bad upper respiratory infection at the beginning with cough, runny nose, red eyes. You'll have children complain of a sore throat as well as high fever. Then the rash develops, typically starting at the head and working its way down through the trunk, down to the arms and legs. Those are the common symptoms of measles.
So if you see those things, then you definitely need to contact your doctor or physician.
You want to contact your doctor or physician or call the urgent care or call the emergency room before you go so that they can put you in a door to avoid a waiting room and expose other people.
Good to know. Well, how contagious is measles? You know, we hear about these cases popping up. What makes it different from other infectious diseases?
Measles is the most contagious infectious disease on the planet. It is spread through the air, through tiny droplets that tend to hang in the air. And so even after a person has been out of a room for the next 2 hours, that room still has measles floating around, and you can catch measles just from being in the room where that person was.
Where does vaccination play into all of this, and what's the current vaccination rate here in Texas?
Vaccinations are the only form of advanced prevention. Vaccines, including measles, mumps, rubella vaccines, are very, very effective in preventing measles. I don't have an exact number for the state of Texas, but I would venture to say that it's over 90% are vaccinated. We know that you have to have 95% of your local community vaccinated to stop the spread of measles. 95% gives us what we call herd immunity or community immunity.
Well, thank you so much for those tips and for that information.